Okay, the pathway of the blood through the heart. We're going to look at it as if it's just a few blood cells. So blood's going to return from the head and upper limbs through the superior vena cava. It will return through the azygous vein from the thoracic cavity, return from the lower part of the body, lower limbs, through the inferior vena cava, return from the heart itself through the coronary sinus. All deoxygenated blood returns to the right atrium, flows through the tricuspid valve to the right ventricle, out through the pulmonary semilunar valve to the pulmonary trunk, and then away from the heart through the left pulmonary arteries and right pulmonary arteries. It's going to return to the heart through the right pulmonary veins, left pulmonary veins. Now it's oxygenated, returns to the left atrium, flows through the bicuspid or mitral valve to the left ventricle, and then out the aortic semilunar valve to the ascending aorta, aortic arch, and descending aorta. On the aortic arch, the blood is going to leave through the brachiocephalic trunk to the right arm and right side of the head, through the left common carotid artery to the left side of the head, and through the left subclavian artery to the left arm. But if you're looking at the way the heart actually works in the cardiac cycle, blood returns at the same time. From the lungs, it'll return through the pulmonary veins to the left atrium, and then from the body to the right atrium. It will flow passively through the ventricles, then atrial systole will push the last amount into the ventricles, on the right side through the tricuspid, on the left through the bicuspid, and the ventricles will fill. And then ventricular systole will start, and the AV valves close. The semilunar valves will open, and the blood will be ejected from the right ventricle through the pulmonary semilunar valve, from the left ventricle through the aortic semilunar valve at the same time. And when blood tries to return back to the heart as the ventricles relax, these valves will close. So as the ventricles relax, pressure builds up in the atria. It will open these AV valves, and the process starts again. And that's it.